Hi, everyone. I'm Wirta. Welcome to Aging in Action. I'm with my co-host today, talking with Sherri McArthur, and we are here discussing the PPE shortage in Greater Sudbury and the North in general, and actually just getting some feedback on what we can do as a community. So welcome, Sherri.
Welcome. Thanks so much for including me in this. It's an important topic, both for our community, but especially for our frontline healthcare workers that are going to be most work putting themselves in precarious situations during COVID-19.
So Sherri, what can we do right now as a community? I mean, it doesn't matter where you go, CTV News, the radio, heart radio, media, social media, Facebook, right? We're constantly hearing about the N95 mask shortage, having the PPE gear. We see a lot of community support with organizations and businesses coming forward. But for our general audience and us ourselves, how can we help and what can we do differently? And maybe you can explain a little bit about what it is, PPE.
So Sherri, sorry, I was just going to ask, are you a nurse in the community, or what's your role in the healthcare profession?
I'm a registered nurse.
Okay,
yeah.
Great.
Yeah, so the number one thing we can do is protect people that need to be using PPE with social isolation. And when you're on social media, we're seeing a lot of discordance and disagreement about what social isolation is and distance is. So if somebody doesn't live with you, we shouldn't be visiting those people during this time. And really just maybe an emotionally difficult thing to do during this time, but something so important we can do to keep our healthcare workers safe, because if we don't have them, we really become in dire straits for sure. I'd been asked to talk about this, and I was thinking, what could I want to be so much informed. So I reached out to some people for some information, and what can we do? We are mobilizing, from what I've seen on Facebook and Instagram, our community partners, but maybe starting to dig a little bit deeper. So I'm somebody that kind of likes plans, and I struggle with the addition of the small details. So do we have people out there that can organize the recruitment of these, rather than just general send out? And do we have anybody out there with really great organizational skills, who is a person that pays attention to the details, that can actually go through lists, pick them off, make phone calls, gather the data? So one of the things that was mentioned to me was like resourcing our skilled people out in our community. So our organizers is one group of people that would be effective, so that it's a cohesive effort rather than kind of like a mass email help if you can. Some organizations may not be aware that they can help, but having that phone call or organize would pique their mind to think about what they could do.
Well, wedding planners, I think, would be awesome. Not too many indoor weddings happening right now, but to me, a wedding planner, right, Gwen, is kind of one of the most
organized
people out there.
That's a skill set. So one of the influencers I was speaking to last night was really talking about us resourcing the many skills we have in our community. The next one I would go to think of is our safety companies. So companies that I've heard through the grapevine that have become involved already, like Safety Solutions, NORCAC. So these are people who don't do health every couple of months. Their job, this is their. So I'm certainly not telling any hospital or health organization what they should do. But would we be utilizing these people's skill sets? Valet has dedicated health and safety people who don't don PPE once every 3 months. They do this as a regular part. So refresher courses maybe for the nurses and other healthcare people. How does this equipment go on properly? What's the best way to use it? So do we have any retired health and safety people that we could recruit to help direct us to be using what we do have effectively and properly.
Like, how bad is it, Sherri, with regards to the shortage of the gloves, masks, and the ventilators? Like,
yeah,
we keep hearing it, but how bad is it?
Yeah, so I wouldn't comment to cause any mass hysteria because I don't have exact numbers, and I'm not connected with the information from, say, any of our large healthcare providers in Sudbury. So we're talking nursing homes, the hospital, outpatient clinics, all those type of things. But I think we just need to click on to Instagram and Facebook. While not all the information is correct, certainly we do know that a lot of our unions, ONA, for example, are sounding the alarm, are aggressively advocating for frontline workers, paramedics, firefighters, nurses, respiratory therapists, doctors, for their safety. When we talk about N95 masks, the one thing I thought about yesterday, they're provided to bury down paint and wallpaper, I understand, made large. So we have people who paint and sand as a job who have access to N95. We have
wouldn't really think about,
it's a dust mask. It is a dust mask.
Yeah, exactly.
So where it's like a respirator and that type of thing, but it is the mask that is known to reduce the particulates, to decrease the danger to the people that are providing care.
Yeah, I mean, I've used them myself for drywall, right? When you're
100%. So, I've been trying to stay a little bit off of social media. Nice to make sure we have fact-based information, which is why I'm making it clear I don't have all the facts. But if we don't have our healthcare workers, we can just see what other cities and countries are dealing with. And it's a numbers game, right? So we have amazing nurses and doctors and respiratory therapists who are, from what I hear, planning for worst case scenario. But it becomes a numbers game. Too many people, it's difficult to care for. So we want them to have the best equipment. And so my understanding is that most places are putting into place their practice. So there have been comments online from nurses about what they're being asked to do with PPE, how to preserve it, whether it should be put in a bag and reused or not. I don't know the facts, but I have been hearing comments like that in the community.
Like, as far as the public too, wearing a mask and wearing gloves to go out shopping or whatever, like, I've heard the best protection you've got is your own skin, and to wash your hands and use hand sanitizer. But every time I go out shopping now, I see, and I think there's kind of that whole thing about like how the toilet paper went. Everybody sees you doing it, so they feel like you've got to wear a mask and gloves. Like, what's the real truth?
Well, I think that we need to look to the experts for the complete truth. I wouldn't want to give misinformation again, but hand washing is a cornerstone by anybody that you're going to listen to, any of the specialists, and proper hand washing. So hand washing effectiveness comes from the friction. Sorry about that. Comes from friction as opposed to what you're using. So if you're using hand sanitizer and the 1-2 scrub, probably not as effective as the person who's using pump soap, who's singing happy birthday twice the fronts of the
Well, I can tell you the men in my household have been retrained.
Yeah, exactly. I have a background in nursing where I had a very compromised group of patients I took care of, and one of our doctors would at times, if he was in a particularly funny mood, write hand washing as an actual order in the patient chart. So it is that essential.
Yeah, it's important.
Tons of resources: YouTube, Instagram, Pinterest, public health messages on what that is. It's important to review it with our elders, with our children, our teenagers, and I think, talking on that's kind of a special spot for me. Having a teenager in my home, really taking the time to be a leader as a parent and social life is very, very important to these guys. Now's the time to make sure that we use all their electronic devices in ways that they can get together without letting them hang out with each other. And so, again, I go back to the first thing I talked about. You don't have to make a lot of decisions as a person in the public. You're not out in the public that much.
Right. Yeah.
You know, so.
Well, your teenage daughter can use this platform to have all her friends chatting.
Yeah. There was a joke on Facebook talking about, thank God this isn't 1985. How there would be no way to talk or see anybody. I was FaceTiming my dad, elderly and vulnerable, and where he lives, they're not allowing anybody in to help. He can't get groceries on his own. He requires personal support. And so it is a very difficult time to not be able to provide that support for him. So we're getting innovative. One of the things I put on my son's to-do list, more than doing his homework, is connect with somebody. So think of the people in your life that could use that emotional support because they're feeling cut off. Mm-hmm. And I know this doesn't have to do with PPE so much, but get on the phone, call your uncle, dad, your father, and say, how are you doing? How are things going? And I know my dad found it really uplifting to get a call from my son text. So those are helpful things too.
Mm-hmm.
Sherri, if somebody would be interested, like let's say hypothetically this goes out live and we have, not live, sorry, but we put the video out in our podcast and someone's like, hey, like I'm a wedding planner, or I'm laid off now, I'm at home and I could definitely do some phone calling or maybe assist in some way. Could they reach out to you personally to just say, here's my number, what do you need from me? Or is there a way for someone to just create that group themselves?
Yeah, so, if somebody's completely not knowing what to do, I'd certainly take a phone call, and I wouldn't make the decision on my own. I'm going to resource the people I know that are good.
Yeah, and that's the best way to do it, right?
Feel that they really have those advanced skills, and they're able to start something on their own. And I don't know what about our healthcare groups would think, but there have been messages out from members of HSN publicly asking for supplies. And I do think there was a number attached to
yes. That. Yeah, the HSN does have a number on associated with their posts to say, here, contact us if you have this because we're in need.
Mm-hmm. Exactly. So I just think it's so important to keep people safe. And there is some discrepancy and disagreement and some really robust conversations going on between healthcare providers and frontline staff about what is the right thing for people's safety. And all I think to myself is, we're on what side do we want to err?
Yeah, exactly.
I'm going to sound a little melodramatic. History is going to watch what we do. And what side do you want to be on? How do you want to be remembered? So if you're a decision maker out there, I would implore you to think about asking what it is that you're fighting for or against. Are you fighting against healthcare providers having the best protection? And if wrong, where do we sit and how we feel about that when this is all over and done? Because thankfully there will be an end to this.
Oh, absolutely. Yeah.
Oh, I agree.
Yeah. I do like how you touched on the emotional side, though, for so many. I think that's really important. And I understand, yes, we are discussing the PPE shortage and making sure that we can help those frontline workers, may they be nurses, PSWs, anyone in our community that is in need. But I also think it's really important too that, you can pick up the phone and call someone. Even your grandchildren can pick up a phone number of a long-term care and ask if there's some residents they can speak with, right? Not everybody has family or friends nearby that they can call, or maybe they don't have the luxury or affordability to have a phone. So knowing somebody's reaching out, I think those are important factors in our community, and that's what's going to set us above the rest.
Yeah, I agree. And I think there is actually a direct correlation with PPE. I know that some suppliers in Northern Ontario are not allowing the public to buy masks anymore. They were, now they realize they can't. And so my nursing brain says to me, well, why are people looking for PPE? Because they're out in the public, because they crave connection, because they're having difficulty not maintaining their social life. It's important to their mental well-being. So if we can hit on those topics with people and keep people well, I think you'll see people more easily taking part in social isolation, and then the need for PPE amongst just the general population, I naturally just see a decrease in it because it's not out.
Well, I don't know if the analogy is right, but I kind of picture, you know, when they talk about like you're on an airplane or whatever, the parent should get the mask first so that they can help, right? It's kind of like, I feel like the healthcare professionals, I want you to have whatever safety.
Gwen, excellent.
Gwen, that is awesome.
Yeah, it's good ideas, eh?
I like that. You're right.
But you want the person to be there healthy.
Yeah, it's true. I mean, we don't need it. We can go out to the grocery stores, wash our hands, disinfect, make sure you wash your produce, your vegetables, your fruits, do all the things to keep yourself safe. I need to know that my community doctors, nurses, healthcare professionals, PSWs, that they have the tools and resources they need to do the job for those that do need them today.
Yeah, it'll protect us as a community for sure. And again, I go back to utilizing some of these larger corporations to complete health and safety. It's what they do every day at work. So my analogy is, I don't necessarily want this put out there, but if you're having a bony cancer, the doctor we want to see in Sudbury is Dr. Sadie, because he specializes in oncology. So he does it more often than the other folks. So you want to go and see him. So I kind of think of that the same with these health and safety, Mine Rescue, NORCAT, NAT, and like I said again, I know NAT already had some involvement. Resourcing these group of people for their expertise. They do this every day. It's not their sideline, it is their main business. And then talking about PPE, I should have opened up my screen before I called you, but there are cartridge based, and I may not have this information because this is not my area of expertise, but there are cartridge type PPEs that are available. And I had mentioned that places like Inco may have many of them, and not aware that these are, what are our other viable options? What are other types?
Plan B. If you don't have plan A, what's plan B?
Yeah. Right. Rather than and I appreciate the community support around sewing PPE, but talk to an epidemiologist or an infection specialist, and they will very quickly tell you that a hand sewn mask is not appropriate for anybody within our healthcare system. So there may be a role for the public, but definitely for our frontline workers, we need to be looking at medical grade uses.
Yeah, because that would be a good thing if you are out shopping, because I do see people with N95s on their face and they're shopping, but maybe they could be the ones that are taking the homemade, and there's some of them are beautiful, and maybe that's a fashion statement nowadays.
Oh, geez.
Well, and I had actually heard one thing, because I was kind of a bit anti-homemade masks, but one person did mention something that caught my interest, is that they had heard that they may be used for practice. In like regards to, there's a specific way you have to put them on for them to be effective. And you don't want to utilize a real N95 mask to practice how to put it on. So again, getting creative and asking people who have expertise. The other thing I've seen is people showing, like, you can make buttons so that the loops aren't around your ears. And if you've been in any of the testing for N95, there's a reason why you don it and over the top. There's a very specific reason why it goes on to create that seal, keep the wearer safe and free of whatever it is they're trying to avoid.
Yeah. Well, I think there's so many things that we can do as citizens and individuals, and to help out. There's lots, and maybe there's somebody out there that can organize people to do whatever. But yeah, there's a lot of knowledge in the city, because you're right, like the mining industry and construction and any big manufacturing, they've had to deal with health and safety issues, and that's part of it is the N95 masks and other things too, the gloves, the whole thing. So there are experts in our community, and they may not realize that they could be of help.
That's exactly what the people I was speaking to last evening to get some ideas were discussing is, not waiting for some outer group to come in and save us, because this is such a large problem that really do the feet on the ground, if you will, and mobilize here within our own community with what we have. And of course it has to be in an organized, non-chaotic way. So
Yeah.
Yeah, that's not where my skill set is, but I've got lots of big ideas, so I thought I could.
Greater Sudbury's big on innovation, and they're huge on, creativity. So I'm sure we'll come up with something somehow.
I agree. I think we certainly.
Well, Sherri, we so appreciate everything that you do, and I know there's so many unsung heroes out in the community right now that, from the healthcare professionals all the way to the grocery clerks and everything in between. And I think we're starting to realize how much we depend on each other and on the people that are right out there in the front lines right now.
Yeah, kindness is going to be the cornerstone, I think, of how we get through this. Being posts about how cashiers are being treated, trying to go the limits that they have on products and that kind of thing, and it's a part of each other. It's I can't express that enough.
Yeah. No, kindness goes a long way. It's because you never know when you're going to need help from somebody, right? And
Just don't.
Maybe that young kid working in a grocery store, whatever, you think it's okay to yell and scream at that kid. You never know who he's going to be or when. I always figure you never know who you're going to need in this world to give you a helping hand. And just treat each other with respect no matter what.
Yeah, it'll make this a much easier time to get through for sure.
Well, it's yelling and screaming at somebody isn't going to make this end any sooner, right?
No.
Do we pull together as a community and help each other whatever way we can? I mean, for some people they can't. They have to stay home. They have to do whatever, but they still have their minds and their brains, and they got a keyboard in front of them, and they can help that way. Yeah.
For sure.
For sure. Thank you. No, we'll definitely share that and see what we can come up with. And hopefully there's a good Samaritan out there, someone with a kind heart that has some expertise and a skill set that says, hey, I can take on this challenge, and I know where to start. We'll keep our fingers crossed, but we also know a lot of people.
We got connections.
You got connections, girl. We can do this. We can definitely help make this city a better place today.
Yeah.
Thank you.
It was surprising the response I got quite quickly last night. It was I was introduced to two pretty phenomenal individuals. So if nothing else, those connections I'll probably keep, I think, long term about this.
Oh, that's awesome. No, I sometimes, it's just, like you say, a matter of a conversation taking place.
Yeah.
We can bring so much good in our community. But one day,
Yeah.
and it will all pass. But it'll be a great learning experience, and it'll be wonderful stories to share after about community.
Laugh and laugh someday, right?
Thanks, Sherri. We appreciate you taking the time today, and we know that you've, given us a lot of food for thought and what we can do to help better our community also. So thank you so much.
Okay, thanks for now, guys.
Bye.
Thanks, Sherri. Bye.
Thanks, Sherri.